We're all human. And it's important to know that doctors are people too. Doctors have emotions, they have passions in life and hobbies, and they enjoy participating as active members in the communities where they practice medicine. Doctors have families, friends, and relationships. While the latest in healthcare and the most current treatments for ailments will be topics on this Doctors Are People Too radio TV show, the focus will be in learning more about the interesting aspects in a physician's life and what they do away from the doctor's office or operating room table.
Hello, South Florida and beyond, and welcome to Doctors Are People Too. I'm really excited tonight. I want to jump right into it. I got a lot of questions for a physiatrist we're having on the program tonight, Dr. Charles Graubert. Physiatrist is physical medicine and rehabilitation medicine, if I got that right. Dr. Graubert, how are you doing tonight?
I'm doing great. Thanks for having me.
And did I get that right? Physiatrist, physical medicine, and rehabilitation?
Yes, you did.
Okay. On your website also it says non-operative orthopedic medicine, so there's a tie-in to that as well as the specialty. Is that correct?
Yes, that's true.
And then you also do EMG testing, NCV testing, and acupuncture.
Yes, I do all those things.
And we're going to get right into that. Now that we got over physiatrist, I've never had one on the program, so I just had to knock that out and make sure I'm getting that right. Now, a physiatrist oversees a patient's direct rehabilitation. Is that the way we should define it, or I'll let you since you're the expert?
Well, what we first do is we evaluate patients by taking a careful history and then do a physical examination. And the type of problems that we treat are problems mostly affecting the musculoskeletal system and the nervous system. So it can be a host of injuries or problems. It could be injuries to the musculoskeletal system, things like simple sprains and strains to care after fractures and orthopedic surgery and joint replacement and things like that, but can also be injuries to the neurological system, like head injuries and strokes and spinal cord injuries, or even some people that have congenital birth defects, things like cerebral palsy, or people that have other neurological issues like MS or Parkinson's disease and things like that. So what I'm involved in is overseeing and designing rehab programs, and also developing programs with physical therapy and occupational therapy, and sometimes speech therapy.
And let's talk about, you're with the Orthopedic Center of Palm Beach County. I know you guys have 3 locations. Now, you do most of your the rehab and medicine that you direct is done right there at the Orthopedic Center of Palm Beach County?
Well, half my time I'm in my office. So when I'm in my office, I have an orthopedic-based musculoskeletal practice. So I'm seeing more of the orthopedic-based injuries and problems, sprains and strains and problems with the neck and the back and knees and shoulders and things like that. And so we do have a full PT and OT department in our offices. And so I'm able to diagnose the patient and provide therapy services for them in the office, or if they choose to go outside the office as well.
You go there as well. Now, you guys have 3 offices at Orthopedic Center, Palm Beach County's Lake Worth office, Boynton Beach office, Wellington office. Do you service all 3 offices? Or?
I go to 2 of the offices, the Lake Worth office and the Boynton Beach office.
And the number there is 561-967-6500. That's 561-967-6500. I got a lot of info from you on off your website. It's ocpbc.com. Great website where you can get a ton of information, and a huge physician team. I mean, there must be like 15, 16 different physicians. I actually had one of your colleagues on the program not too long ago. Now, how do I know when I need to see a physiatrist? This is something that I would be referred to because I'm actually injured. I wouldn't seek one out on my own. Is that normally how it works?
Well, I do get referrals from my colleagues, but I also have patients that call in and either request to see me or they're not really sure what doctor in our practice they need to see. So our staff screens the call and figures out what their problem is, and they try to match the physician up with the patient so that the patient sees the physician that can help them the most. So a lot of the things that I'll see in the practice would be patients will come in and say that they hurt their neck lifting or building something over the weekend or doing some gardening. They hurt their neck, they hurt their back, or maybe they were in a car accident and they need a physician to evaluate them. So I oftentimes am the first person that they see. And especially if they don't have a fracture and it's more of a soft tissue injury or maybe even a disc injury, I take care of those things too.
Now, as part of your team, do you have someone who can help prospective patients talk about insurance and what will be covered as well at Orthopedic Center of Palm Beach County?
Oh, yes, of course. Yes. I mean, every patient, when they call to make an appointment, they're asked about their insurance, and all their insurance is verified. And we take a lot of plans, but of course, ahead of time, everything is verified so the patient knows what their individual responsibility might be.
Okay, and as I said before, I had one of your colleagues on the program late last year, Dr. Gary Richmond, specialist in pain medicine and anesthesiology and interventional pain management. Tell me a little bit about the rest of your team at Orthopedic Center of Palm Beach County.
Well, we've got one physician that just does pediatric orthopedics. And actually, we just added another physician, and he's mostly based out of the Wellington area. So we have 2 board-certified and fellowship-trained pediatric orthopedic specialists. We have a fellowship-trained orthopedic spine surgeon. We've got 2 physicians that do pain management, and they're anesthesiologists. One is Dr. Richmond, and then we have another physician that does that as well. We've got 3 doctors that do foot and ankle surgery. And we've got 3 physicians that do upper extremity, shoulder, elbow, and hand surgery. And we've got another physician that does sports medicine, another physician that primarily takes care of knee and hip injuries.
Wow. So you're covering everything in orthopedics. I mean, pretty much
from head
one
to toe.
From head to toe. And once again, that's Orthopedic Center of Palm Beach County, numbers 561-967-6500, or a great website, ocpbc.com is the website. How long have you been practicing medicine?
I have been practicing in the South Florida area for 23 years, and it was the first practice that I joined, and I remain with the practice for that amount of time.
There.
Yes.
That's great. That's awesome. Are you on staff at any local hospitals in the area?
Well, as a physiatrist or physical medicine and rehab doctor, there's not a lot of opportunity to do hospital work for my specialty. But nonetheless, I am on staff at Delray Medical Center and JFK Medical Center.
Okay. So Delray Medical Center in Delray Beach, obviously, and JFK Medical Center in Atlantis, correct? I believe it's the city of Atlantis.
That's true, yes.
Right over there, okay.
But my partners, because a lot of what they do involves surgery, they're on staff at multiple other hospitals in the area.
Okay. Why did you decide to become a physiatrist?
When I was in medical school, I really had an interest in the musculoskeletal and nervous system, and wasn't so sure that I wanted to do or be involved on the surgical side, but had learned about the field from another friend who was a few years older in medical school and had just got accepted into a residency program. And so the more I asked, the more I learned, I decided this might be an interesting field for me. And so I made the decision at that time to apply for the residency, and here I am now 23 years later.
Nice. And where did you do your residency at?
Well, I went to medical school at the University of Miami.
Okay.
I did my residency at Parkland Memorial Hospital, which is through the University of Texas Southwestern Medical School in Dallas.
Oh, very good medical school. And you can find all that. Your CV is actually online right at your website.
Yes.
I thought that was pretty neat how your webmaster put that up, or the team of doctors did. Now, I wanted to ask you, and this is the part of the program I really wanted to get to, is acupuncture. I think I've had it a few times, actually I should say for a few different stretches of time, maybe 6 months at a time for different ailments. And I'm totally, it helped cure the ailments that I had. Now, how does acupuncture help with pain management? I know it seems like a basic question, but how does it actually help with what you provide?
Well, so for the first 10 years of my practice, I'd only heard about acupuncture, and patients would come to me and maybe ask me what I thought of it or did I do it. And at the time, I didn't have a lot of information, so I really couldn't recommend it. And I did some research and decided that it might be an interesting area to go into for a lot of different reasons. But one of the reasons would be an alternative way to treat patients without prescribing medications. And at the time, there was a lot of negative publicity about using narcotic medications for pain management. And we're kind of getting back into that now. So I found a course through the University of Miami which was relatively local. So it's about 45 minutes away. And knowing that I had graduated from that medical school, I felt that it would be a very informative and reliable course. So I looked into it. I took the course, and that was back in 2004. So for the last 12 years, I've been doing acupuncture. The course was about a 6-month course, and I went on weekends and all day. And we did acupuncture on each other, and we also had demonstrations, and it was a very interesting and thorough educational type of course. And so I came back and just immediately knew that this would be something that I'd be able to do, because the meridians or the channels or the pathways that diseases affect oftentimes correlate to nervous system pathways. And so I had a really detailed knowledge of that through my formal education and training. So, and also using needles. I was already doing injections, routinely in my practice. So putting an acupuncture needle in is easier than doing an injection. And so you find different meridians and pathways along the body that correlate to where somebody might have an injury or a problem. And of course, you're trained to do that. And you insert the needles, and the needles can be very beneficial in helping either alleviate completely pain or significantly decreasing somebody's pain. Now, I specifically do the acupuncture as a pain management tool.
Okay.
There are acupuncturists that will do acupuncture for high blood pressure, for insomnia, for ringing in the ears, for appetite suppression, for smoking cessation, and things like that. I did learn how to do some of those techniques, but I really wanted it to be an adjunct to what I do in musculoskeletal medicine. So that's what I focus on now.
Okay, and I know it's a case-by-case basis, but is sometimes acupuncture covered by insurance?
Occasionally it is. I would say on a more rare occasion it is. Under some workman's compensation plans, they'll pay for the acupuncture. But I would say the majority of insurances do not cover it.
Okay, well, that's good to know. Hold that thought. We're going to talk a little bit about acupuncture, nerve testing, and a little bit of the treatment for the neck pain and back pain with Dr. Grabert on Doctors Are People Too.
My dad is a cardiologist, and so I have 2 brothers, and we were all equally painful to my mom. And so to get us out of the hospital, we would go on rounds with him on Saturdays and Sundays in the hospital back in Oklahoma City. And we used to, race wheelchairs down the hallways from the time I was about 6 years old. When I was a freshman in high school, I got to watch my first heart transplant. But I think what really kind of made me want to be a doctor was around the holidays. The house always filled up with tons of gifts from thankful patients, and to impact people's lives like that in a positive manner was something that was very exciting to me. I'm very patient-oriented. I care about the patients both professionally and personally, and not only about their result, but also that I'm passionate about new technologies. I'm passionate about research, and I'm passionate about offering them the best technology available with the lowest risk and with the best outcome. What you want in a physician is someone who is personable, works as a team, embraces new technology, is clearly accomplished, but I think most importantly is somebody who you get confidence in. And the way I would have confidence is if I had a condition, I would read as much about it as I could before I showed up, probably off the internet, and then ask very directed questions. I do a lot of exercise. Running is what I use to kind of calm my brain down and kind of sort my thoughts out. So I enjoy, I just will put my shoes on and go for a run, and then I do mix in a little bit of yoga, something probably not many people know about me. I keep that on the down low, but so I do some yoga, and I go to the gym like most people.
Tenet Florida Physician Services is a multi-specialty physician group providing care to the communities of Palm Beach, Broward, and Miami-Dade since 2007. The TFPS team is committed to delivering quality care. Our mission is to improve the quality of life of everyone who walks through our doors. Today, we are proud to be one of the largest and most respected physician networks in the area. To learn more about Tenet Florida Physician Services, visit tfpsdocs.com. That's tfpsdocs.com. or to find a doctor, call 1-866-654-2362.
You are listening to Doctors Are People Too with David DiPino, who shows us the human side of medical doctors in the community. If you have a question for our guest, call into the show at 888-565-1470. Now, let's get back to the fun side of doctors and show that they are people too.
And we're back. We're here with Dr. Charles Graubert. He is a physiatrist, that's physical medicine and rehabilitation with Orthopedic Center of Palm Beach County, 561-967-6500 or ocpbc.com. I'll give that out a few more times. Just a couple more questions about acupuncture. Obviously, I'm fascinated with acupuncture. How long, I know you're doing it for pain medicine or pain management. How long do I end up seeing someone like you for? Is it something I have to do for the rest of my life? Is it something that until the pain subsides? How does that work?
Well, typically you would come in for a treatment session, and it's most of the time once a week, but occasionally I do it twice a week, and the sessions are between 15 and 20 minutes. And typically I'm doing 4 to 8 sessions, and I'm usually helping somebody significantly enough that we don't have to continue, or we cut back on the frequency and maybe they come once a month. Like I have a whole handful of patients that come in for monthly maintenance. Mm-hmm. So their pain is controlled enough that they come in once a month. And then other people I help enough that they don't ever really come back in, which is really an amazing type of thing. That's something I learned early in acupuncture, that you can really help somebody so significantly that their pain is gone. Mm-hmm. Now, there's always a small percentage of patients that I can't help at all with acupuncture. Mm-hmm. So if I can't help you after 4 sessions, I will just tell you that I don't think it's going to be successful and we can stop the treatment.
Okay. That's nice to know. And moving right along, while doing my research on electrodiagnostic studies or EMG and NCV testing, I read the question, did you know the body is an electrical generator? Is that true? I've heard that with the heart obviously has a lot of electric going on, but is the body an electrical generator?
Well, yes, I would say yes, because your brain is creating impulses that travel down the spinal cord and then into the peripheral nervous system. And those impulses are electrical impulses. And those impulses control your movement and your thought processes and really the whole homeostatic neurological balance of your body. So you can measure those. Mm-hmm. You can measure the electrical conductivity of the heart by doing an EKG. And now for the nervous system, you can measure the electrical abilities of the nervous system by doing EMG and nerve conduction studies. EMG stands for electromyography, and so it's kind of a 2-part test. The nerve conduction study part involves actually stimulating the peripheral nerves and then measuring their amplitudes and their velocities and comparing those to a standard set so you can determine whether there's an injury or disease to peripheral nerves. Oftentimes those are done in the arms and legs, and that helps you determine if somebody's had a nerve injury or has a neuropathy or something of that nature. And the EMG part of the test is actually a needle that's inserted into different muscles, and that needle will give information because a normal muscle has a certain wavelength and a certain sound that's characteristic of normal, but abnormal findings also have characteristic sounds and waveforms. And so you can tell whether there's been a nerve injury that causes the muscle to have what we call denervation potentials, or there can be an intrinsic problem like a myopathy. We don't see that as much in this area, at least in private practice. You see that a lot in university settings when people may have like muscular dystrophies and myopathies and things like that. But we do see them every once in a while. So you use both of those tests together to help with your diagnosis of people that have problems with the neurological system. And in my specialty of physical medicine and rehabilitation, it's part of our training. So we're trained to do these studies for the 3 years that we do our residency. So by the time you finish your residency, you have to have done 200 or more supervised studies so that when you come out, you're proficient in doing the studies. So I've been doing the studies. I probably do anywhere from 4 to 7 a week, and been doing that in my practice.
Nice.
for 23 years.
You're like a medical detective. This is fascinating. I mean, I know physicians, their job is to find out or do their best at finding out what ailments or what diseases are going on. But this is like unbelievable. I mean, it's like a medical detective. It's really neat. Let's move right along. How do you evaluate neck pain? How do you treat and evaluate neck pain as a physiatrist?
I think, it's similar to what an orthopedic surgeon would do in the sense of you take a history, you do an examination, and then if you have to, you order studies to evaluate what the anatomy is like. So in our office, we can do x-rays right in the office. We also have an MRI scanner in our office. Sometimes we do MRIs in the office. Sometimes we send the patients out. MRI is probably the best test to look at injuries or what we call pathology involving the discs and nerve roots. So oftentimes if somebody has severe pain that's been longer lasting, so we'll say it's more of a chronic problem, we'll get an MRI scan because a lot of times that's a degenerative condition with or without a disc problem. And this is the same for the neck and for the back. And so they come back in a short time later and I read the study and also look at the report that the radiologist has provided, and then oftentimes pinpoint a diagnosis, and then I'm able to, tailor make a treatment program to help them with their problem.
I see. And you also treat neck, you said neck and back pain, muscular strains, disc herniations, spinal stenosis. What is spinal stenosis and how is that evaluated and treated?
Well, when somebody comes in and tells you they have pain in their neck or pain in their back, it can be something simple like a muscular strain, and that usually gets better in a few weeks. And you don't need to have a diagnostic test for that, especially if they haven't had any trauma to their spine. But their pain could also be attributed to a degenerative condition in the discs or the facet joints, which are tiny joints that surround the spinal column. And they can get inflamed and they can become arthritic, and so they can cause pain. It can also be from a disc herniation, either in the neck or the back. And so an MRI is often the test that we use to help diagnose that. And then there are different treatment options that you can, use to get that person better. And that can be medications, it can be therapy, it can be acupuncture, it can be injection procedures. And if all those things aren't effective, then there's the opportunity to have surgery if the patient's a candidate for that.
I see. And you also treat arthritis in the knees and shoulders. You just mentioned injections, trigger point injection. How do you use that to help patients?
Well, trigger points are tight bands of fibrous connective tissue in muscle that are oftentimes there as a result of an injury. And you actually palpate the trigger point. A lot of times they're in the lower back muscles and the muscles around the neck and in the shoulders, what we call the trapezia muscles. And when you palpate them, you can feel a tight band. It almost feels like a small sized pea underneath the skin. And when you palpate that, it elicits a very painful response. And so based on some research and some landmark medical discovery that was done by a famous doctor about 40 years ago, Dr. Travell, who sort of is the godfather of what we call myofascial pain and trigger points and trigger point therapy. You can inject those areas, and we call those trigger points, with a small needle, and you can either use saline, you can use some anesthetic, you can even use a small amount of steroid. And the whole idea is to break up that tight little fibrous area. And by doing that, you can give somebody almost instantaneous pain relief.
So is that for the shoulder, knee, hip?
Most of the time it's for the neck, the trapezius, the lower back, occasionally thighs, calves, things of that nature. But that's different than having a problem with a joint like a shoulder or knee. Okay,
I get that. Now, what is a question you would hope most patients would ask you? What is a question that you hoped you were asked more often by patients? I always like to ask that question to physicians. Is there something other than one way or another that you wish more patients were aware of or kind of asked on a regular basis? I mean, I guess it's different because you're kind of directing their pain.
I think perhaps if they would ask me what they can do to help themselves get better.
Mm-hmm. Okay.
In other words, we can prescribe and we can treat and we can inject, but sometimes it's behavior, exercise, weight loss, things of that nature. If a patient can be a participant in their care, then they can oftentimes get themselves better and assist in their recovery.
Definitely. And we always like to ask, as a doctor, what do you do to stay in shape?
Well, I go to the gym about 4 or 5 days a week. So I try to practice what I preach.
Mm-hmm.
And I'm careful about, my diet and try to stay active and fit and exercise. But I've had my share of injuries too, so I have to be careful about what I do.
More weekend warrior stuff? Or?
Well, I've been a weekend warrior. I've had a herniated disc in my back, and I ruptured my Achilles tendon, and I've done those types of things. I actually share those things with my patients. And oftentimes it's very effective because, especially if they're younger, and I tell them, well, I've herniated a disc in my back, and I was playing basketball doing that. And I got back to being able to play basketball, and I had a few epidural injections, and I went through physical therapy, so I know what you're going through. It can be very.
You've had the experience.
It can be a powerful tool. I think when you've experienced things as a physician and you can relay that back to the patient, that can be very powerful for them.
And what are your hobbies and passions in life outside of medicine when you're not busy directing, this type of care?
I'm a sports nut. Love the local teams. I'm from South Florida, so I'm a big Dolphin and Heat fan.
Oh yeah, Dolphins had a good year.
We had a good year.
He had a good run up until this year, though.
That's right. That's right. We had our good run.
Who do you like in the Super Bowl?
I'd like to see the Falcons.
Yeah, me too.
I'd like to see them have an opportunity to win.
They finally got an opportunity to get there.
Yes.
So that's important. Well, I really appreciate you coming on the program. I know I kind of jumped a little bit all over the place, but I wanted to get it in as much as I could. I'd really like to have you on in the future. That's Dr. Charles Graubert. He's a physiatrist, physical medicine and rehabilitation with Orthopedic Center of Palm Beach County, 561-967-6500 or ocpbc.com. Really like to have you on the program again. Thanks for coming along on Doctors Are People Too.
Thanks so much for having me. I had a good time.
I make a dinner for me and my girlfriend. We ate, we enjoyed. The dinner was very good. She was ready to go to sleep. I said, okay, I'm gonna stay on the couch a little bit to watch TV. I started to feel something in my throat, like I was choking, and all of a sudden I feel the pain, the sharp pain, like somebody put a knife in your back and open and do like this. That was when I called my girlfriend. I said, you have to take me to the hospital. I couldn't die. When they were doing the test, they saw something was weird. My valve was ripped. I said, God, please help me to get out of this. Dr. Valle was on call. He was who performed my surgery. I described like an angel. I described like he was there to do that for me. My girlfriend, my son, he told me when they saw him getting out from the operation room, he was sweating. He was tired to be there for 10 hours. For me, it's unbelievable. I can walk, I can exercise a little bit, and I can drink red wine, that light red wine. Of course, 1 glass or 2 glasses. I see the life different. And I want to see my granddaughter to grow and my son to get old. So I wanna live. I think that God gave me one more chance in life, and I had to take advantage of this.
Love Katie Cakes specializes in paleo, gluten-free, vegan, and regular sweets. Whether it's a cake, cookies, muffins, bites, or delicious treats, Love Katie Cakes is available for your special occasion. Katie DiPino is a certified pastry chef. Call her at 561-635-5831. It's Love Katie Cakes, LOVEKATIE KAKES @gmail.com, Facebook, and Instagram.
You are listening to Doctors Are People Too with David DiPino, who shows us the human side of medical doctors in the community. If you have a question for our guest, call into the show at 888-565-4900. 1470. Now, let's get back to the fun side of doctors and show that they are people too.
Hello, South Florida and beyond, and welcome back to Doctors Are People Too. Without further ado, I want to introduce Dr. Alonzo Grant. He's an OBGYN on staff at Hialeah Hospital and a physician with the Jesse Trice Community Health Center with an office based at Hialeah Hospital. Dr. Grant, how are you doing tonight?
Pretty good. So how are you doing?
Great, thank you, and thank you for coming along on Doctors Are People Too. Now, you're an OBGYN physician. You have a unique background, though. You actually are on staff at Hialeah Hospital, but is it correct to say, I haven't seen the office, but you have an office with the Jesse Trice Community Health Center right there at the hospital? And then also, if you could tell us a little bit about the Jesse Trice Community Health Center.
Sure. Yes, I do have an office there in the medical building right adjacent to the hospital. And Jesse Trice is a great organization. It's a nonprofit organization that's a fairly qualified healthcare center, and actually it's pretty awesome. Given the fact that it was first in the state and third in the nation, serving the community for almost over 50 years. Then they have multiple different, over 54 different centers, including the one in Hialeah Hospital, as well as 40 school-based locations as well. And we serve about 45,000 patients annually. So it's a great organization. I'm glad to be a part of it.
Wow, that sounds like an amazing organization. Now, what types of prenatal care for high risk and low risk pregnancies do you offer at Jesse Trice Community Health Center at Hialeah Hospital?
We do comprehensive prenatal care. I mean, we see patients that we if we have high risk patients, we tend to consult specialists that are, around the same area if we have anything high risk and multiple complications associated. But usually with the general obstetrical care, we usually contain everything there. But the good thing about that also is that if we need to refer a patient out, we have multiple different resources and primary care physicians associated with the facility, ophthalmologists, dentists, the whole nine. So we're able to take care of patients from head to toe if necessary.
Okay, and just so I have this right, this is an actual office at the Hialeah Hospital, correct?
Right. My office is OBGYN based, but, Jesse Trice has a bunch of locations that offer different services as well. So, we can refer as necessary as we need to.
Okay, so you're like the Hialeah satellite office for Jesse Trice Community Health Center.
That's correct, yes.
Okay, and we're here with Dr. Alonzo Grant. He's an OBGYN, obstetrician and gynecologist with Hialeah Hospital and the Jesse Trice Community Health Center at Hialeah Hospital. Hialeah Hospital phone number is 305-693-6100, and the website is hialeahhosp.com. That's HIALEAHHOSP.com. Now, Dr. Grant, we were talking earlier this week, and you were telling me that your practice is about split right down the middle, 50% obstetrics and 50% gynecology. Now, is that just the way it seems to work out, or do you kind of focus to split it down 50-50, the care you provide in obstetrics and gynecology?
Well, we have the ability to do 50-50, but we tend to have a lot of pregnant patients more so than GYN at this time. But we can offer any services for gynecology that you need, but lately we've had a lot more pregnant patients than GYN patients. But we can offer either one. It just tends to be that way sometimes.
Is there a time of the year that's more busier for pregnancies than other times of the year?
It's interesting. A lot of times it's usually about 10 months after the beginning of spring, or I'd say right after, about 10 months after the beginning of winter.
I see. So 10 months after the beginning of spring, that's like right now.
Right. Yeah, we usually get a good boom around December time, January time. Right when everybody comes back outside, we have babies tend to come around 10 months after that, and also when it gets really, really cold, winter times, we get babies coming around 10 months after that. It's pretty interesting.
Oh, wow. I didn't know that. Okay, so I want to actually ask you also, what age range of patients do you see at the Jesse Trice Community Health Center at Hialeah Hospital?
Okay. Well, we see patients. I've had patients as young as like 13, 14, all the way up to 90 years old. Our range goes pretty vast in that regard.
Okay. What is now you deliver babies at Hialeah Hospital. What is the busiest time of the day for delivering babies? I've always wondered that question. Is it at nighttime? Is it during the day? Is it midday?
Well, we'd love for them to be in the middle of the day. That would be ideal, especially, lunchtime or something like that. That'd be great. But oftentimes, you manage a pregnancy throughout the day, and they always want to come around 10 o'clock at night or 3 o'clock in the morning. It just seems to be that way. But, it's like occupational hazard, I guess.
Oh, wow. So that's the busiest time, 10 p.m. to 3 a.m., those 5 hours.
They tend to seem, I don't know what it is. I guess they want you to miss the nighttime news, but we always tend to get the busiest, the babies coming in around, I'd say between like 8 to 4 o'clock in the morning would be that time frame when a lot of babies tend to want to come in and be delivered around that time.
Now, is there any correlation with weather, humidity, that kind of thing? I mean, I don't know if that's a myth or if it's just people kind of say that thing, thunderstorms, the pressure dropping.
You know what? I mean, sometimes it could be a lunar rotation, like a full moon. We tend to get a few bursts on that time. A lot of stuff happens around those times, and also, around times when you have big storms, humidity drops, and the pressure drops, and the babies drop too.
And you were saying you deliver a lot of babies at night, 10 p.m. to 3 a.m. Are you a night owl yourself, or is that something that's easy for you to be awake during those hours?
Actually, yeah, that's one of the reasons why I chose this field, because I figured, I am a night owl, and I tend to get my second wind around 2 or 3 o'clock in the morning. So that hit right up the alley for me, because a lot of times that's when we're doing the most work, especially during residency. So it didn't fit me pretty well.
And I should tell the listeners why I'm so excited about so many questions about, childbirth. Is my wife is pregnant, and it's something that I just find fascinating. And I figure I have an OBGYN, so I'll have to rip through the questions. So that's why I was really so excited. But it is something, everyone should be excited about. I mean, it's an amazing process. Let me ask you, how many babies have you delivered in your medical career?
Oh, by the way, congratulations. I just wanted to tell you that. That's awesome.
Oh, thank you. It's our first. It's on July 1st is the due date, so really looking forward to it.
Oh, that's great. It's hard to say. I'd say, give or take, I've delivered almost about 900 to 1,000 babies by now. Since the beginning of residency back in 2003, I'd say I've done probably about 1,000 births, almost 1,000.
Oh, wow. And is that how long you've been practicing medicine, since 2003?
Well, I mean, residency, I don't really consider that to be, we were training at that time. I don't know if I consider that to be practicing, but since when I finished in 2007, yes. And
where did you go to medical school?
I went to medical school at it used to be called Medical College of Ohio in Toledo, Ohio, but now it's called the University of Toledo Medical Center. But it was in Toledo, Ohio back in from 1999 to 2003.
I see. That's great. Where are you originally from?
I was born and raised Los Angeles.
Oh, okay. Neat.
Mm-hmm.
What brought you to Florida?
Well, I was living in Pennsylvania and freezing, and then my wife was not very happy with that, so she wanted to find her family lives down here in Florida, in Miami, and so when I was graduating from residency, my attending said that you can draw a dot on a map and draw a circle, a 200-mile radius, and he said if your wife's family lives there, 95% of you will live within that circle. And I fell right through that. So I moved down here because a happy wife is a happy life.
That is true. That is definitely true. Now, I want to also ask you a couple more questions about pregnancy, obviously. What are the factors that help you make the decision of a vaginal delivery versus a cesarean C-section delivery? We kind of hear, about C-sections here and there, but I think the general public, or even a novice like myself, don't really understand it. When is it necessary versus a more traditional, regular delivery?
Okay. Well, we always tend to try to go for vaginal deliveries. I mean, if we can, if with everything going well, that's the first option we like to go with because it's a natural way and it, patients recover really fast and it works well. But it all depends on the, how the baby's developing, if there are any medical problems that the mother may have. The size of her pelvis. A lot of times, if the pelvis is too small and the baby's too big, or if the mother has other kind of medical conditions like HIV or the presence of infections like herpes or something like that, sometimes those make you have to make the decision for C-section. Another one is when you're following the baby through pregnancy and at the time of labor. If the baby's tolerating labor fine, then you can proceed with the vaginal delivery. But if you assess the baby's in distress or there's any kind of complications that could arise, then you probably want to go with the C-section depending on, but that sometimes you have to make the decision at the time of delivery. It's hard to predict it beforehand, but sometimes you can predict it based on the fetal size and the size of the mother's pelvis.
Okay, so that's something, sometimes it's something, it's a split-second decision in the operating room, obviously by a highly trained expert like yourself. It's not something that doctors really go into. I think there's a myth about that sometimes that maybe some doctors maybe want to do that. I don't want to put anyone, push anyone under the bus, but so it's something that it could be decided right in the operating room then.
That's correct, yes. I mean, there was a myth that people didn't want to wait for deliveries because sometimes they had to work the next day. But the thing about it is that you try to give the patient a good chance to deliver vaginally if you can, and you try to do all. And I try my best to make sure that they do. But if there's any, I explain to the patient at the time, like, look, I don't think this is going to work, and I think this is what we need to go. But it's always a decision that I keep them informed of the process throughout the whole process, and I think that's the best way to go.
Dr. Grant, hold that thought. We're going to take a quick commercial break, and on the other side, I want to talk to you a little bit about January's National Cervical Health Cancer Awareness Month and also birth defect prevention month. So very timely topics. Stay right there. We'll be right back on Doctors Are People Too.
Hi, my name is Dr. Rahul Agarwal. I'm an interventional cardiologist in Jupiter, Florida. I did my medical school at the University of Florida and my internship and residency at the same program. I did my chief residency also at Shands, and then did my cardiology and interventional cardiology at Wake Forest University in Winston-Salem, North Carolina. I specialize in general cardiology, interventional cardiology, and nuclear cardiology. Even though I'm an interventional cardiologist, the majority of my practice involves general cardiology. General cardiology is a pretty broad spectrum in that it involves rhythm problems such as atrial fibrillation, heart disease such as coronary artery disease, congenital heart disease, high blood pressure, and cholesterol problems. I do procedures such as cardioversions, which involve trying to convert the patient back to a normal rhythm if they have an arrhythmia. I also deal with plumbing problems such as the coronary arteries, which if they're blocked, I can do angioplasty and stents, which involves balloons that open up the arteries. And these stents act as scaffolds that keep these arteries open. I really do believe in preventive medicine, and one of the areas that I really focus on is diet. One can really get caught up on the pills aspect and the exercise. And diet we talk about a lot, but unless one really has some guidance as to where to go with diet, it can be quite difficult. So I do give my patients homework in terms of books or movies that they can rent or obtain so that they can get educated. Our cardiology office is located in the Abacoa area of Jupiter, Florida, conveniently located between two of the local hospitals. We provide echocardiography, stress testing, ultra monitoring, and general cardiology office visits. We really pride our practice in its staff, who are very courteous and professional. We believe that under our care, you'll feel the same way too.
Tenet Florida Physician Services is a multi-specialty physician group providing care to the communities of Palm Beach, Broward, and Miami-Dade since 2007. The TFPS team is committed to delivering quality care. Our mission is to improve the quality of life of everyone who walks through our doors. Today, we are proud to be one of the largest and most respected physician networks in the area. To learn more about Tenet Florida Physician Services, visit tfpsdocs.com. That's tfpsdocs.com. Or to find a doctor, call 1-866-654-2362.
You are listening to Doctors Are People Too with David DiPino, who shows us the human side of medical doctors in the community. If you have a question for our guest, call into the show at 888-565-1470. Now, let's get back to the fun side of doctors and show that they are people too.
And we're back with Dr. Alonzo Grant, OBGYN, on staff at Hialeah Hospital, and also has an office with the Jesse Trice Community Health Center right there at Hialeah Hospital, 651 East 25th Street in Hialeah, numbers 305-693-6100, and hialeahhosp.com. That's HIALEAHHOSP.com is the website at Hialeah Hospital. Dr. Grant, I wanted to ask you a couple questions about cervical health, cancer awareness, and birth defect prevention month. But first, since we're still on the topic of Hialeah Hospital, there's a special care for high-risk newborns offered at the hospital. Is it correct that it's a level 2 neonatal intensive care unit you have there at the hospital?
Yes, sir. Yes, sir.
Okay, and that's for high-risk newborns?
Yes, it is. I mean, we can tolerate pregnancies up to about 30 weeks gestation, 32 weeks gestation with any kind of problem. But if necessary, we refer out to other facilities if necessary.
Okay, and take us into your team, your collaboration among obstetricians, pediatricians, and neonatologists at the hospital. What's the team like?
Oh, we have on staff there. We have a perinatologist who's always on at call. There's always a perinatologist there. We need to talk to them as well as we have the anesthesia docs there at all times. For anything, and then the nurses are always available. And then we also have I believe we have maternal fetal medicine specialists as necessary if we need to as well there. So we have people to consult and not to mention the rest of the medical services like, hospitalists and such like that. And if we need to consult any of them, they're usually readily available.
And then after birth, the hospital offers lactation consultants. Is that correct?
Oh, yes. Yes, sir. Yeah. We have lactation consultants come through. I mean, they have a lot of very nice services there. Even for prenatal, they have, birth classes, and they give you tours of the hospital, and they do lactation consultations at the bedside if you need to as soon as you give birth. So, and they give you little just things to help you along to get you started with diapers and stuff like that, and packets for after you deliver when you go home. So a lot of services there available for you all through from before through postpartum period.
Okay, and also take us into the hospital offers private labor suites. What are those like for someone who hasn't been in them? Is it I read here on the website delivery and recovery rooms, a bathroom and shower, adjustable bed, couch and reclining chair for your labor partner, etc. Take us into the private labor suites.
Oh yeah, no, the labor rooms are very nice size, very large. They have all the facilities you need right there. I mean, everything we need, we have right there readily available. From the delivery from the instruments that we need for delivery, they have bathrooms there and pretty comfortable chairs too. I have to admit, because sometimes if the rooms are open, I'll sit in one while I wait for another labor to go, and so it really does feel nice. So I have to say I like them myself.
Nice, and you were mentioning before. Some of the programs too. There's patient navigators at the hospital, extensive educational programs that provide child birthing and parenting education classes in both English and Spanish, and couplet care where your nurse cares for the mother and newborn, family-centered mother and newborn care at Hialeah Hospital. So January is actually National Birth Defects Prevention Month. what are some of the ways women can prevent birth defects? I did some research early on folic acid, but so folic acid supplementation. But what are some of the other things that, as well as folic acid, that can help prevent birth defects?
Well, the thing about birth defects is there's so many things that can cause these abnormalities, including genetic abnormalities or environmental exposures and such like that. So a lot of times even the etiology of these things can be unknown. So it's the best thing for prevention of these things is early prenatal care, so we can try to see if we can catch anything early, and so we can intervene as best we can.
I see, and that includes the testing as well. That's done very early on. That not only can tell the genetics, but rule out some kind of disorders and whatnot.
Yes. I mean, they have different kind of things from chorionic villus sampling to neural tube nuchal translucency, or even if we can do a quad screen. All these things happen between I'd say about 8 weeks to about 10 weeks, and then others happen between about 10 to 13 weeks, and another test that we can do, between 15 and 18 weeks. And all these are geared to try to catch these defects or any chromosomal abnormalities before it's, before the pregnancy progresses too far along. But even if those were positive or negative, we still do an anatomy scan to check for any kind of structural defects around 19 to 21 weeks gestation. And if those seem to be either normal or abnormal, if necessary, we can also do what we call an amniocentesis, which is where we draw fluid actually from the amniotic sac, and we can actually take a look and see the chromosomal makeup of the baby. So there's multiple different ways that we can intervene, depending on where the patient is at that time and her gestational age.
I see, but most important is to see an OBGYN with prenatal care, correct?
Yes, I think that would be the best bet, is to start as soon as you find out you're pregnant, make an appointment, come in so we can get the process going, check the blood, and do a thorough history and physical, and that way we can get everything on board and just watch the patient all the way through the pregnancy.
And then also January is also Cervical Health Awareness Month. Seems to always be in the news with vaccinations and screening for to prevent cervical cancer and the HPV virus. Now, do you offer at the Jesse Trice Community Health Center at Hialeah Hospital cervical health vaccination and screenings?
Yes, we do. We offer the Gardasil shot. They have different variations of 9-valent, and the different. The shot varies based on how many forms of or types of HPV that it covers. But yes, we offer that series at the Hialeah Hospital, and at our clinic at Jesse Trice, and also we do cervical cancer screenings with pap smears and such like that, and colposcopies if necessary.
For the vaccination for the HPV virus, what age range of young women do you see for that?
I believe it's between, 13 to 26 years old is what the age range that we usually offer the Gardasil shot for them.
Okay, 13 to 26 years old. Okay.
Mm-hmm.
Now we have a couple more minutes, so I just want to ask you. I was going through your resume, and I saw that you did some presentations on excessive weight gain during pregnancy. Now, isn't it okay for a woman to gain a lot of weight during pregnancy, or how can excessive weight cause problems during the pregnancy?
Well, excessive weight gain is always basically individually based. I mean, a very thin patient can usually gain up to about 25 pounds without a problem, but an obese patient, usually we're kind of worried if they gain over 15 pounds at that time. But these things can also, with excessive weight gain during pregnancy, you have a higher risk of having shoulder dystocias and complications at birth. And you have to deal with what we call a macroscopic baby, which is really large for gestational age. And sometimes you have those you have to do mechanical deliveries, or sometimes you even have to go for C-section based on the fact that that she might have gained too much weight and that the baby can't fit down the birth canal for whatever reason, or the baby might be too large for her pelvis now because of excessive weight gain and that sort of thing. So these things we have to really keep a close eye on weight gain during pregnancy. You can gain weight, but you just can't gain too much. But we keep an eye on that, and we track it with each visit.
Dr. Grant, one more question. What are your hobbies and passions in life outside of medicine?
Well, I used to play football in college, so I'm a huge football fan and sports fan. I love football, and basketball, and I love playing tennis, and I just love everything about being out in the sun, especially here in Florida. But aside from working, I just spend time with my family and my two boys.
Nice. Well, thanks again for such an informative interview and coming on the program. I'd definitely like to have you on again. I think knocked out like 25 questions in 30 minutes. That's awesome.
Well, thank you for having me. I appreciate it.
And that's Dr. Alonzo Grant, OBGYN at Jesse Trice Community Health Center at Hialeah Hospital. It's hialeahhosp.com. And thank you for coming on Doctors Are People too.
Oh, no problem. Thank you very much.
Thank you for listening and watching Doctors Are People Too with David DiPino. Join us next week for more in-depth views on what doctors are all about and how they spend their free time. All shows can be seen on amp2.tv. And if you have questions you want answered on the air, call 866-224-5422 and leave a message that can be read on the air. The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of this station, its staff, management, or